Hello everybody, my name is Grace Bogdanov. I'm 1199 SEIU Area Vice President for our Western New York Nursing Home Division. We are here today with members representing 12 of our for-profit facilities across Western New York in Erie and Niagara counties. These members behind me we're here today for a labor roundtable with our local elected officials and Congressman Higgins to tell their stories of short staffing, high turnover, and their fight for fair wages right now, as all 12 facilities have expired contracts and we've been in negotiations for months, fighting for a decent living wage, fighting to make sure that these employers meet area wage standards that other nursing homes have already met in the past year, and ensuring that we have enough quality staff to provide that quality care to the residents moving forward. So I want to just thank everybody for being here today. The mic over to Congressman Higgins.
Thank you very much. We're elected officials from the county, the state, the federal government, and we just heard an hour of testimony from these folks who work in our area nursing homes. And it says something about, we heard what was both magic and tragic. The magic is the incredible commitment emotionally and professionally that all of these folks have for the people whose care they're entrusted with. The tragedy is they're not paid well. They have poor staffing. The system is rigged in a way that gives an impression that the staffing and quality care at these facilities is actually better than it is. And those are the stories that they told. And I just want to pass it over to Lisa Shamira, who is a member of the county legislature. And then after, you should hear from some of the folks here. Thank you.
We actually heard from the most passionate people who are caring for our most vulnerable members of our community, our family. And we call it a nursing home for a reason, because we have these individuals who require a certain level of care, and it's their home. And these people behind us provide that home and provide that care. But they're short-staffed, they're underpaid, and they're not receiving the respect that they so well deserve. And we need to change that. They deserve better, and the people in our nursing homes deserve better.
How you doing, guys? My name is James Funderburk. I'm an employee at Elderwood at Williamsville. I've been there for close to 12 years, and from the time I started to now, it's a big, big difference. We all know about the money part, and that is really, really important. But one thing I choose to talk about and stress about is the importance of the residents. If you guys don't know, it's a pretty penny to stay in a nursing home. And for a long period of time, especially during the pandemic, we more so getting out of it now, but at the beginning of the pandemic, the unsurety about COVID, family members, they couldn't visit. So a lot of times, all of the time really, they didn't know what their family members were going through. They didn't know the kind of treatment they were getting. And like we touched on in our discussion that we had behind closed doors, one of my fine union fellow members had touched on, these residents are not here at a nursing home to pass on. They're here to live. And due to the simple fact that they see us more than they see their families a lot, we should have time to be pulled to the side if they want to talk about a TV show that they watched last night, or if they want to talk about how good the pepper steak and rice was the previous night. We should have that time to be able to discuss that. But with the short staff And a lot of times, a lot of us is working in more than one department just to keep the building afloat. We don't have that time. It's certified nursing assistants that they'll take care of 7 people, then they'll have to go cook breakfast. And again, they're getting paid close to minimum wage. I don't want to take up too much time, but I just ended off by saying I never thought I'd see the day where you'll be close to minimum wage for taking care of a human life. And that don't sit right with me or any of us here. Thank you for your time, guys.
Hello, I am April Stonebreaker. I am an LPN at Elderwood of Lockport. I have been there for 12 years. I have been in healthcare for over 18 years. We are here on this campaign to fight for good wages for everyone who works in these nursing homes and takes care of these residents. We need to get the wages up for comparable wages in this industry so that not only for us to earn a living and be okay, but more importantly, and the most important thing is we need to get staff into these buildings. We do not have any staff in any of these facilities taking care of these residents. We need to be able to get new employees in the door, and we need to retain them. The most important thing is the retention. Our turnover rates are terrible because we cannot keep anyone in the facilities at all to work. They come in, they get trained, they see what the working conditions are like, and they are persuaded to go work for agencies. They're persuaded to go to other facilities that have raised their wages up way above ours. So we do not retain any of the staff, and we are left short once again. So it is very important for us to win our fight, win our battle that we are fighting today to bring these wages up for everyone so that we can take care of our residents. Everyone standing here today has the same bottom line interest, and we want better care for our residents. Thank you.
Hello, everybody. I've been in healthcare for 44 years. My name is Lori Beeman, and I've seen a lot of changes in the years. When I first started, it was a great industry. We had plenty of help. It was a livable wage at that time. Since then, things have really gone downhill. I work in the service department, which is your housekeeping, laundry, dietary, and that department. Activities is also considered that. And what I hear from my coworkers is that we're unappreciated, that we're not, they don't pay us enough even to barely pay for our gas to get to work anymore. We make, they start out 20 cents above minimum wage. 10-year employee might make 70 cents, 90 cents above the starting rate. And they consider, because we're a service worker, that's what our worth is. It's a struggle for the people I work with to feel like they have worth because they aren't treated like they are worth anything. So we love our residents, and that's what keeps us there. We're compassionate. We're their family when they don't have family. So I just really feel that this needs to be addressed, and the wage is of big importance to get people into the industry and to see what we see and to care for the people and how rewarding it is to make their day, make them happy, and just be a friend to them. Thank you.
All right, so before we open the floor real quick to questions, I just want to give a little bit of background. The members you see behind me represent 12 nursing home facilities, all owned by different for-profit owners, out-of-town owners. So we have the McGuire Group, Autumn View, Seneca Manor, Northgate, and Garden Gate. We have Elderwood Lockport, Elderwood at Williamsville, Buffalo Center, Ellicott Center, Newfane Rehabilitation, Fiddler's Green, and Humboldt House are all represented here, as well as Gowanda behind me with all the members that you see in front of you. For the first time in our Western New York history, we are beginning a coordinated campaign across all 12 facilities, moving towards job actions at every single one, and eventually taking whatever action necessary to win these wages. This is a fight for 15 for service workers. This is a fight for better wages for all healthcare workers in these for-profit facilities, where owners are making a business decision to choose to pocket taxpayer monies rather than put that money directly into the residents and the workers that care for those residents. So I'd like to open it up for any questions.
Start with the Congressman. What can you do at your level?
Well, all of us have leverage. I mean, this is most of the patients at these facilities receive Medicaid. And it's a program that is federal, state, and local. And using that as leverage for better wages, better staffing, but also greater transparency to know exactly what's going on. You know, you have to look at the full experience that employees have, and thus the quality of service that the patient is receiving, or the resident of a home, of a nursing home, which has already been said by others. So there's that leverage, but you always need accountability, and these workers are highly committed. We saw it demonstrated today in their individual experiences, but we see it every day. You know, my dad was in a facility for 3 years, and it was low-paid workers. And you know, if you don't have a patient base, a resident base that can complain to an authority, then nothing changes. These individuals are dedicated public servants, and they're taking care of the most vulnerable among us. Every day in America, 10,000 people turn the age of 65. And those people, many, will eventually end up in one of these facilities. So through empathy, put yourself in their place, not only the residents, but also those that are entrusted to take care of the residents.
What kind of wages are you all looking to have, and how much staff or how many people would satisfy the staffing needs that you all talk about?
Across all 12 facilities, we are fighting for a $15 start for service workers and for pay scales for experience that we have won at other area nursing homes. We know this can be done because other area nursing homes like Weinberg Campus have agreed to these rates and these wage scales, and they have hired new employees since implementing these wage scales. And so that's what we're fighting for. And as far as accountability on improving staffing, 1199 SEIU has created an online tool for nursing home accountability where we have taken the publicly available data provided by CMS to show facility by facility across New York State which facilities are in compliance with the 3.5 hours of minimum resident care per day legislation that was passed just last year, and which facilities are out of compliance, and how many days of that quarter they were out of compliance.
Grace, explain that when you're talking about raising the wage that our area minimum wage is $13.20.
And I will add that when we talk about this fight for 15, we're talking right now about service workers at these facilities working in dietary, housekeeping, and laundry, currently making at or near minimum wage in Western New York, and that is $13.20 an hour to provide care and to perform work in a nursing home where, like Congressman Higgins said, the most vulnerable members of our community live.
So as far as like the staffing, like how many people would satisfy the staffing that you all say? You said some say there's not enough. What would be the maximum amount of staff to fulfill that?
So if you actually look at this nursing home accountability website that we have put up online, you can see that one metric that we have put in there is how many more staff a facility might have to hire in order to meet the 3.5 hours of resident care per day. So what you will see is the average hours of care per day over the most recently available publicly provided quarters data. Then you will see how many days out of that quarter that facility was not compliant. And then you will see a column that reads how many more staff they might have to hire in order to meet that metric.
I've asked Dennis to pull it up on the screen.
Any other questions?
We talked about the lawsuit.
Anything for the members?
Maybe just talk about, this is also a national push that nursing home workers are, doing across the nation. Can you all talk about, like, the importance of banding together in that room? The National Day of National. And why it's important? She's asking about the National Day of National.
The National Day of Action is actually next Wednesday. And to speak to your other point as far as like how do we band together, the one thing we have in common, aside from the financial, is the residents. Every last one of us here has been working at our respective facilities for north of 10 years. So when you're anywhere for that long, no matter what walk of life you come from, you find your similarities with residents, fellow co-workers, and things of that nature. And when you see residents that you have grown to care about immensely suffer and have to ask for things, the simplest things, more than once, more than twice, to the point where they feel like they have to stop asking because they're not going to get it. That's the one thing that bands us together, and for everybody nationwide, they can understand where we're coming from, and I'm pretty sure it's other facilities that's not here that go through the same thing. So to answer your question, that's how we band together, because no matter what walk of life we come from, we all have one thing in common, and that's the residents. And I need this is very important. We're not fighting to get over. We're not up here crying about wages that we don't need. We need this. We're fighting for fairness, not only for us, but for the residents. Thank you.
If you spoke, can you go up and give us your name and the spelling and your title?
My name is James Funderburk. My last name is spelled Funderburk. I work in environmental services at Elderwood at Williamsville, and I've been there for 11 years.
My name is April Stonebreaker, Stonebreaker. I'm a licensed practical nurse at Elderwood of Blackport.
My name is Lori Beeman. It's Loribeeman. I am in the housekeeping and laundry department, and I have worked at Fiddler's Green for 44 years.
I'm Grace Bogdanov. It's GraceBogdanove, in Western New York Nursing Home Division Area Vice President for 1199 SEIU.
Are there any more questions about the Nursing Home Accountability website? We're going to pull that up on the screen momentarily. And it is on the bottom of the press release that was sent out. Any more questions about the 70-40 law, the 3.5 hours of staffing, the 5% profit cap, or any of the downstate ownership groups that own the 12 facilities? I believe Grace talked about how they're participating in the lawsuit.
I don't know if I mentioned that to this group.
No, okay.
Would it be helpful?
Yeah, it would be helpful. And talk about profits,
Sure.
their location, and their creed.
So across these 12 facilities, they are owned by 6 different ownership groups. So this is not one employer with 12 facilities. It is 6 owners across 12 facilities. And all 6 of these ownership groups are in one way or another involved in a lawsuit against the state for the 70-40 legislation that we were able to pass. 70-40, for those of you who don't know, is legislation that requires 70% of a nursing home's revenue to be spent on resident care, and 40% of that 70 to be spent directly on the staff who provide that care. And what these for-profit owners are doing are fighting back against a lawsuit that rightfully directs taxpayer monies into the residents and into the people who provide care for these residents, so that they can instead profit off of that money and funnel those revenues into things like related party transactions and continue to profit off of the work that these employees do and off of these residents.
Do you want to put some of their names out there, Grace? The owners, the
Sure, so the McGuires are owned by, majority owned by Edward Farbenblum. Buffalo Center and Ellicott Center, majority owned by Kenneth Rosenberg. So just a couple of big names for you, but you know the names of all of the facilities. And all of these are out-of-town for-profit employers, like I've said, who can do the right thing. It's simply a business decision that they are making to continue to keep wages as low as they are.